So we're hoping to educate our viewers on what they can do to look at long-term care, get a lot of answers for many of the questions that they have. And Kathryn, I think you can really help in that regard. First of all, just introduce yourself, your title, and what your role is with the state.
Yes. Hello, my name is Kathryn Lanier. I am the Section Chief for Elder Rights and Special Initiatives at the North Carolina Division of Aging and Adult Services.
And tell me what that role entails.
Okay. I oversee several programs that are advocacy based within the Division of Aging and Adult Services that is part of the state's Department of Health and Human Services. And one of the key programs that we'll be talking about today is the Long-Term Care Ombudsman Program. And it is the program designed for individuals who live in long-term care facilities, whether that be nursing homes or adult care homes or assisted living, as most of the public is probably used to hearing them referred to. So that is one of the major programs in our section. We also oversee the Senior Community Service Employment Program, which is the only federally mandated program, job training program for older adults age 55 and over. We also encompass legal services for the elderly, and as its name implies, assuring that older adults, individuals typically age 60 and over, have access to legal resources. And we also oversee consumer affairs types of things to make sure individuals who are older are not defrauded or scammed out of their life savings. So we are basically the advocacy and awareness arm of the division.
So let's drill down for families. If they have a loved one who may need to be put into long-term care, even before that process starts, what is your advice to those families as they begin the process of looking?
I think probably one of the most important things is to have the conversation. And that should be done when family members are still relatively healthy and are able to contribute to the conversation. So maybe convening that family meeting and asking your loved one, what are their wishes? If there should ever come a time and place that they are no longer able to be cared for in the comfort of their own home and have to go to a long-term care setting, what are some of the things that they would want to be in that environment? And then take it from there and take those things into consideration in terms of when you start looking. Oftentimes, unfortunately, when we meet families, they are near crisis situation. Their loved one is typically coming out of a hospital setting, whether that be from catastrophic illness or something that is long-term, that they are no longer able or safe to return to their own homes. So unfortunately, time is not on their side. So it's always best to try and at least plan ahead a little bit to try and think about what those potential outcomes may be.
So clearly the needs of that individual are going to be paramount in terms of what type of setting you're looking for. Would they come straight to your office? And then if that is the case, what's the process? What's the conversation from there?
Thanks. That's a great question. Really, the most important thing is to make sure that your loved one has the correct designation for the type of care that they need. A lot of times, individuals use nursing homes and assisted living interchangeably, but they are actually two distinct types of care settings that an individual will receive. A nursing home setting is really based on a medical model of care, i.e. your hospital. This is where you have trained medical professionals who are attending to that person's needs because they are of a severe or significant nature that it really requires that very intense scrutiny. Whereas an individual who may go into an adult care home is more so what we consider a custodial model of care, hence where we get the term assisted living, that the individual may indeed have some significant health concerns or conditions, but yet they are still able to maintain their well-being with some assistance. So it's very important to make sure that your loved one has the proper designation for the type of setting that they need to go into. And then it's really not up to, per se, the individual or the family. It is actually a medical decision on both fronts, either type of setting that they need to go into. So it's at your doctor's recommendation as to what will be the most conducive level of care for your needs. And then you go from there in making your determinations as to what you would like for your living arrangements.
So once you get to that point, you figure out those designations. What kinds of questions should families be asking of facilities and of your office?
Definitely. We are there to be able to guide and help families navigate this new pathway. For most folks, it's uncharted territory, and it can be very frightening and confusing. So we kind of help them work through that and look at the types of things that they should be considering. One of the key things is just the basic environment of the facility. When you enter into that building, what kind of feeling do you get? So actually utilizing your five senses. What are you seeing? What are you hearing? Are there any unpleasant odors in the environment? And if so, do they dissipate in a relatively short amount of time? You want to look at the staffing. How are the individuals who are employed there? How are they interacting with one another? But more importantly, how are they interacting with the individuals that they care for on a regular and routine basis? And also want to know, how accessible is administration? How hands-on are folks? Do you see the administrator actually walking around the facility? Do they know the residents by name? Those are just some of the key things that, kind of stand out, because after all, you have to remember, this will be their home. And just as you and I are comfortable in our own homes, this new setting will become your loved one's home, and you want them to feel as comfortable and as content as possible.
So a lot of the things you're talking about, would they show up in state inspection reports?
Some of the things that show up in state inspection reports are going to be more so your rules and regulations. So ensuring the safety, the quality of care of the individuals who reside there. So they're going to be looking at things such as staffing levels, food administration. Are they adhering to specialty diets? Do they have the proper medical staff on hand? Those are the kinds of things that you will find in the reports. You will also find how well the residents are being treated. And that's where the long-term care ombudsman program comes in. It is our role and our duty to make sure that the individual's quality of life is respected. Things that you and I take for granted. Say, for example, when you go home and you go to their mailbox at night, you don't expect your mail to be open. That's a federal offense. Even though the individuals in this setting, their mail is to be delivered to them as well, unopened. So that's just a basic right that people kind of take for granted sometimes.
We gravitate towards grades and ratings and that kind of thing. Should our viewers be looking at the star system? And if so, how much does that even tell you?
Yes, that's always any tools that you can use to help guide your decision making and facilitate your question asking are always going to be helpful. But just like any rating system, you have to do your homework and your own due diligence. But it does kind of give you an indication of how a particular facility is standing. But you have to keep in mind that that's almost really kind of a snapshot in time. It only is representative of that time frame in that moment. So perhaps if there was something negative that appeared in that report, you want to go back and see when was that report actually generated, and has the facility been able to change those things or make different arrangements that they are no longer considered a negative factor.
And for families that really look at those stars and they want the best for their loved ones, obviously.
Absolutely.
Should they say, well, I only want facilities that have the highest number of stars, or is that really just not realistic?
I wouldn't say that it's unrealistic, but I wouldn't put all of my trust in that particular star rating. It's kind of like that phrase, all that glitters isn't gold. So even though they may have 4 or 5 stars, if you really look behind it, are they really living up to those equivalencies of the stars that they have in their rating? So you really want to look behind that and really see, does it really match up to what is being presented?
As we've gone through the pandemic, obviously we've reported on how a lot of long-term care facilities had huge challenges during the pandemic. Are you finding, whether it's inspection concerns or just what you're seeing coming in through the pandemic, real concerns?
Yes, unfortunately, our program, just like the general public, we were unable to go into facilities on a regular basis while we were at the height of the pandemic. So we had to learn how to be very creative and really learn how to rely on technology to try our best to be able to communicate with residents while they're in facilities and continue to serve as that bridge or liaison between residents and families on the outside. We know that there were dramatic changes in staffing levels, that many needs perhaps went unmet, but we're hoping that we're slowly seeing that come back to what could be considered normal again. But we know those numbers are still very dramatically low from where we would really prefer them to be, that the individuals in the long-term care setting can get that individualized care, but it is still very difficult because each worker is still responsible for several residents.
So when you say that number is low, you're talking about the staff ratio
Yes.
to residents.
Mm-hmm.
What can you tell us, if anything, just about the number of inspections? Have they gone down dramatically?
The numbers of inspection, I think, have still kept pace. There are federal requirements, particularly when you're talking about the nursing home setting, that an annual inspection must be conducted each year, and they have definitely returned to that benchmark. Sometimes, however, that term annual is a little bit of a misnomer. When we say annual, typically we're thinking of something that happens every 12 months, but they have a little bit more latitude. It's closer to about 15 or 16 months when that formal federal inspection has to be done. But in the meantime, if there are other issues that arise, those types of inspections or investigations can be done at any time. So it's important to get the most up-to-date information about inspections that have occurred in a facility that you may be considering.
We're joined in this conversation by WRAL Investigates producer Randall Kerr. And Randall, I want to bring you in if you have some specific questions.
Sure, Kathryn. We're gonna walk our viewers through the process of checking the state website as well as CMS to look at ratings, understand them, look at inspections. You talked about the annual inspections and how they're a snapshot in time.
Yes.
Should someone that's considering long-term care for their loved one, it seems to me the number of complaint inspections is almost a better teller of what issues may be happening, especially in complaint inspections with findings, because that shows repeated behavior. Is that something that they should take extra, really concentrate on what those findings are if they're looking at a home?
Yes, that is something that you would want to take note of, particularly as it relates to the care that is given. So for example, if you're seeing complaints where individuals are not being bathed on a routine basis, or medication passes are not being properly handled, that definitely would be a consideration that you would want to take into under consideration. That type of complaint, especially if you see a pattern of repetitive behavior, that definitely would be a red flag if something's going on.
And Cullen mentioned earlier, everyone will look at these ratings, go, well, I obviously want to put my loved one in a 4 or 5 star, the best. But financially, that's not possible for everyone. What can be done to make sure that the homes are as equitable as possible across the state? I mean, is there, aside from federal funding, is there any other mechanism that could help people afford maybe a little bit better home than they normally could?
That's very difficult. When it gets into the pay your source, that's where things get very difficult. It is very expensive, both at the assisted living level of care and the nursing home level of care. The funding, typically individuals go in as private pay, a significant portion of individuals, and another significant portion of individuals go in as Medicaid. And even those individuals who go in as private pay, unfortunately run through their life savings very quickly if they are in for a significant amount of time, and typically will become eligible for Medicaid services.
And I would guess it's a question that a lot of our viewers will have. Do both types of homes, we talk about assisted living and nursing homes, do both of them accept Medicaid or just nursing homes?
Both there for adult care homes, there's a state, it's called state county special assistance, which is a funding stream that is able to help income eligible individuals pay for their room and board care.
And where would they get information about that?
That information and that application is actually made through your local Department of Social Services.
Okay.
What have we not asked you about that you think would be helpful to our viewers?
I'm sorry, could you repeat that?
What have we not asked you about that would be helpful for our viewers who are going down this road?
I would just say the key thing that a lot of times people may overlook when you're going on your visits to the various facilities, if you have that luxury of time to be able to make an informed decision, is to speak with the residents, speak to other family members that you see in the facility. They will be your best benchmark as to the type of care and services that are provided there. They are there on a regular basis, and they can give you the insight that you might need to try and determine, is this going to be a good fit for my loved one? So it's very important to talk to the staff, talk to the residents, and talk to the family members that you meet and encounter when you're going. And we also suggest that you go at different times of the day to see the different staffing patterns, to see the interactions with individuals. That's something that's very crucial to know, along with being able to utilize the tools and resources such as Nursing Home Compare and other types of evaluative pieces of information about facility operations.
You mentioned earlier that ideally people should be doing this ahead of time, having those conversations, starting the planning process, but so many of the people who come to you are in crisis mode. Give me a snapshot of what they end up dealing with if they are in fact in crisis mode. Are their choices far more limited?
In many instances they are, but the earlier that they can reach representatives of our program, the better able that we are to serve them. You know, if push comes to shove, if the discharge planner from the hospital has a placement for the individual, it can simply be temporary. It's not a permanent type of thing. So if the recommendation as to, say, for example, the closest facility for the individual to go to is not of your liking or your choosing, it at least gives your loved one that security that their care needs will be met for that short amount of time while you do your due diligence and you can find a facility that you think may be more fitting to your needs. So it's not a end all one and done type of thing. It doesn't have to be permanent. But many times, like I said, people are in very dire situations, have a very short turnaround, that they do not have the latitude or the luxury of making some of those in-depth observations and things that we've been talking about in terms of finding a placement.
Well, hopefully this conversation can help get those people moving a little more quickly, and certainly very, very important information. Kathryn, thank you so much for taking the time.
Thank you for the opportunity to share.